When the world has got you down. And
Alzheimer's sucks. It's an equal opportunity disease that chips away at everything we hold dear. And to date, there's no cure. So until there is, we continue to fight with the most powerful tool in our arsenal, love. This is Love Conquers Alls, a real and really positive podcast that takes a deep dive into everything Alzheimer's, the good, the bad, and everything in between. And now, here are your hosts, Susie Singer-Carter and me, Don Priest.
Hi, everybody. I'm Susie Singer-Carter.
And I'm Don Priest, and this is Love Conquers Alls. Hello, Susan.
Hi. Do we still have a podcast?
We do. It's been quite a while, and if there's any regular viewers, and I'm sure there's millions out there, you'll notice that yes, our backgrounds are a bit different. We've changed locations.
I don't think anyone would notice that on mine because
yours is similar to the older episodes.
Yeah,
you know?
but we had to cut. I think I said this last time, but we've been, instead of doing bi-monthly, it's once a month, but we're very close to kicking it back up to twice a month again because we miss you and we don't want to lose you. So don't listen to everyone else. Listen to us because we're fun.
Exactly.
Bring you the best guests.
Yeah, only us.
So
what's new?
There's some good news that you know, but I'll share with everybody who's listening is that our documentary, No Country for Old People, has a release date. Dun, da, da, da,
Yay.
after over 3 years, a very difficult production, very difficult, and a lot of hours went into this, and tears and emotions, and a lot of love, and a lot of support from some amazing people. We are here at the gate of I'm just excited to be able to finally share with everybody, because we've been getting that question for the past year and a half. But where can we see it? Where can we see it? So come August 1st, we'll fill you in before then, but it will be released for everybody, and it'll be available, and so far it'll be free for you. So it'll be it'll be available to everybody. We think Amazon. I'm just going to throw that out there, and that's, well, for sure Amazon, but it'll be everywhere else too. But let me hold on that. We've got details for you. But it's very exciting, and it's going to be a docu-series, everybody. So it's going to be, instead of one long film, we have broken it into 3 parts so that you don't miss out on some really very, very important information, because we just felt like it really needed to be comprehensive so that you get a good picture of what's actually going on in the long-term care system, which is really timely because what's going on politically, and not to get political, but there is a lot of
Well, the policies are going to affect everything from here on out. They're going to affect care. Everything about the entire universe of this is going to be affected by the policies that will be coming down the road.
That are coming down the road, and that means that affect Medicare and Medicaid, our ombudsman system, and that whole program is dangerously close of being unfunded, defunded, and that's a problem. So, there's a lot of scary issues out there. And again, thank you ageism, and thank you ableism for allowing this kind of it's really abuse to take away these programs from our population that's the most vulnerable. But we're gonna fight, and there's a lot of us out there that are advocating for this not to happen, and hopefully we'll prevail, because I don't know what's going to happen if we don't. But not to get down, but we need to get activated.
Get
You know,
down.
we have to. We got to get activated.
Yeah,
we got to get down.
And this is not a. This is really not a political thing. This affects
It's
everybody.
not.
This is not
It
left,
really
right,
does.
center. It is everybody. It's humanity, and
Yeah.
you know.
And
so
I think we forget when you talk about nursing homes that we think, you know, a lot of people think, well, we're just older people, they've lived their life and they're going, you know, it's okay. And it's like, but that's not the truth. First of all, older people are people, and we are all going to be older, and we are all going to be affected by the system that is in place and will, and, you know, stands to be altered in a way that's going to be devastating. So we all that, but then there's also a lot of people who are disabled that need to take advantage of long-term care and you know, and can't live without it. So if we and can't afford it because it's very expensive. It's not, you know, our healthcare system is really a wealth care system, and that's the truth of it. It is a business model that serves a lot of people more than the people that are using it. So anyway, I'm off my soapbox for a second, but yeah, a good thing is that Dawn and I are, as you know, we're roommates. We're because I'm single ever after, and I like it that way. And but we've moved back to the Valley where I grew up, and Dawn grew up in the Valley, so I'm back to being a Valley girl again, and I love it.
We are full on Vals again, and
Yeah.
good to be home. And we, you know, as
I
you
love
said,
it. It's so nice and warm, and it's warm at night, and it's like, so, yeah, the Valley is cool. I like it. We were on the west side, you know, Marina Del Rey area, if you aren't familiar with Los Angeles, but like Culver City, that area. And yeah, we're back. So supposedly
and
the Valley's not
recovering-
as cool, but we like
No.
it.
And recovering from a 6-week move that was basically most of it happened in about 2 weeks. And if it wasn't for Susie, I'd still be surrounded by, you know, boxes up to here.
Yeah.
But she does not allow that, and thank God for that. So we're
Oh,
all
it's
set.
so good to get organized,
Yeah,
right?
I'm in
Organization
my own
is so
space.
good.
It is, and I'm in my own space now, my own office. And
Yeah.
Susie's got her own new office.
Life is
and-
good. We've got
Yeah.
we've got separate offices. We're not sharing like I don't know,
Yeah.
like the Dick Van Dyke Show. I don't know, is that an old reference?
That's kind of an old reference, yeah. All right.
All right. Well, on that note, so speaking of the system that is in place right now, and speaking of what the hell are we going to do, should these programs no longer exist, and even if they do remain intact, we still need help because our population is growing exponentially, right? So I was like, you know, there's like Rick Montcastle, our partner on No Country for Old People, always says there's no coincidences. Well, somehow this guest and I got connected by one person that's our mutual friend. Isn't that so crazy? Like this is on LinkedIn. We don't have any other mutual friends, and yet this other woman who's phenomenal thought we should know each other. And we talked, and I was like, couldn't be more like-minded. Only she's way smarter than me, and she's like she's a genius of many different areas. So, Dawn, why don't you introduce this boss? She's boss.
She's a boss. She's a boss, and let me tell you about her right now. Today, we are exploring a transformative approach to one of our most pressing challenges, the long-term care crisis. Our guest today, Breana Patel, stands at the forefront of this revolution, harnessing the power of artificial intelligence to reshape the future of elder care. Breana is a seasoned entrepreneur and the founder and CEO of Owie AI, a company dedicated to real-time patient risk stratification to enhance outcomes and reduce hospital readmissions. Her journey is as diverse as it is inspiring. With a successful exit from a previous venture, she has navigated the complex worlds of Tier 1 banks, financial institutions, and public sector agencies, focusing on regulatory remediations and risk management. With an executive MBA at MIT Sloan School of Management, Breana combines her deep understanding of finance, technology, and healthcare to develop AI-driven solutions that prioritize patient safety and efficiency. Her recent engagements include speaking at the Commission of Health's webinar on using AI for better hospital outcomes. Breana's work is not just about innovation, it's about ensuring dignity, reducing caregiver burnout, and creating a sustainable model for long-term care. We are honored to have her share her insights and vision with us today, so let's say hello to Breana Patel. Hello, Breana.
Hi.
Welcome to our Love Conquers Alls. I'm so happy to have you.
Thrilled to be here. Thank you so much for having me.
Of course. So, it was. I was saying in our opening how I felt like we were so like-minded, and we were talking. I don't know for how long, but it was like, yes, and that, yes, And so I was so excited to talk to you. And when I found out that you were working on AI for long-term care, I think I just think that is the way to go, and considering the population that's growing exponentially. So, I mean, tell us a little bit of your background, because I know it's massive, and you're like, I don't know, 20 years old. So how you've done so much in such a little time.
First things first, I'm not 20 years old. I wish. But so I started my career in finance and banking. And then when 2008 crisis hit, there was a lot of demand for regulatory remediation, risk management. So I started my company in 2014, and I scaled it and recently sold my business. While I was going through the sale, I joined MIT's Executive MBA program, and I graduated from the program last year. I wanted to tap into MIT's ecosystem because this is where all the cutting edge technology is developed, and they provide a lot of resources to find co-founders, tap into the talent pool. So that's where I founded Owie AI, also driven by a personal experience of a loved one going through an adverse event while being in care. It just triggered that how in this times like 2025, hospitals and healthcare facilities are using technology from 1995 in 2025. We need to be more proactive to provide quality care to our patients, and I wanted to make an impact. So that's how I got into building health tech, along with having first-hand experience of serving Department for the Aging with my previous business.
So when you say personal experience, so you had it in your own family that gave you that kind of perspective, right?
Yes. So one of my grandparents went through an adverse event, and no one actually knew, and while she was experiencing that event, and that led to a lot of secondary complications and impacted her quality of life. So had we had the technology where there would be more connected care, caregivers would have been empowered to have that information timely so as to make early intervention. It would have helped in providing a better patient outcome.
Right, got you. So I have so many questions in terms of, I'm sure that you experienced this with your grandmother, is like when you get these secondary problems that happen, right? So that's when that slippery slope and the carousel of going back and being readmitted into hospitals when you shouldn't have to be, and no one is taking care. No one's actually reading the reports. No one's reading records. They're just, looking at everyone like a one size fits all. Is that what you're saying? Is that what you experienced?
Yeah, absolutely. So it's first of all, the caregiver to patient ratio has just gone up really high. As a result, there's less number of caregivers and more number of patients. So it's kind of hard for clinical teams as well as the nurses and everyone on the ground to provide personalized attention to each and every patient. And as a result, the lucky one gets the first chance when something happens, and we wait for that event to happen, and then we take the action. Right. I think with the predictive nature of AI, time has come where we should be able to predict things, and we should be able to take actions before things happen.
And so, like you said, you mentioned like we have a chronic problem of understaffing in our country. It's in long-term care. It's in all of our health facilities, hospitals. Absolutely. Everywhere. So, and the problem, that's what creates the biggest problem, because they don't have the time to actually read records and to see, this person has dementia, this person has Parkinson's, this is their base. They were just admitted last week for this, and so they were given that, right? So it's just they're doing everything as fast as they can, and it's not always a positive result because they're not able to do a thorough job, right? But how
Absolutely.
do we, and how are you looking at that in terms of that issue that I'm talking about, the lack of staff, the understaffing, when how could you facilitate them to be able to have that information at their fingertips and be motivated and the motivation would come with more time, obviously. How does that look? What does that look like?
Yeah, so to take a deeper dive into it, in the next decade, we are going to have almost like 500,000 nurses shortage in the country. So, and I think about hundreds of thousands of physicians as well. So what that does is, as they're serving more and more patients, the systems that were developed in the long time back are not so user-friendly. So it makes it hard to switch from one system to the other because everything is so fragmented and not user-friendly. And that also adds to the burnout of the work. It's not just about taking care of the patients and having more number of patients, but not having user-friendly interfaces or intuitive systems that are going to empower these clinicians and care staff providers to take care of the patients on personalized basis. The second thing is that what happens is these clinicians or care staff, they don't have real-time information about the patient on what's going on with each and every patient at, say, right this second. And as a result, imagine if there's a patient that has multiple chronic condition and is suddenly taken a medication that's going to, say, lower their blood pressure, and they're going to get up from their bed, and obviously when they're going to get up and try to walk, because they forget that they're not supposed to walk unassisted because they have dementia, now they're going to fall, and that is going to lead to a brain fracture or a hip fracture or a brain bleed, and that's going to cause other secondary issues. The length of stay in the hospital increases, and all the other additional factors pertaining to cost and suffering keep on increasing. So with our technology, what we are doing is, with the help of AI, we have like a platform that has modular AI agents, which automate a lot of processes and workflows for this caregivers. And as a result, they are going to work as their digital. Think of it as kind of like a digital. If I'm a nurse, I have a digital assistant that's going to consistently and constantly watch the patients and tell me that this patient is going to experience XYZ in the next hour. So that's how we will be able to predict those types of adverse events.
And that's done without having to have human input as far as the information. I mean, so it's done. That's all basically done by AI. That nobody has to come and say, "Oh, by the way, this is her state right now," or "This is what's going on with her right now." how does
Yeah,
that
everything's
look like?
automated. Everything is automated. So the platform integrates well with the existing infrastructure, and it just pulls information from all types of system, and has large number of data sets where it sees the patterns and calculates everything in real time and provides those insights to the clinicians or the care staff so that they can make decisions for the patients.
And that's done without. I mean, are they hooked up to something? How does that? What's it look like? What does that physical thing or whatever it's doing look like?
No, there's no I mean, we don't have a technology that's going to be touching the patient, or it's not a wearable as well. It's going to be completely contactless. So we're going to be using ambient AI and computer vision to not only monitor the patients for various types of conditions and but also look at their kinematics, and we can measure some of the key vitals that are important to identify if the condition or the acuity of the patient is improving or deteriorating. So we're able to do everything with contactless without even touching the patient's body.
Wow.
Going back to what you were saying, because Dawn, you were asking like how does that interface with the resident. So it doesn't really. It's not something that's interfacing with a resident. We're not talking about robots and things like that, right? I want to, because when you think, so a lot of people think of AI, you think of, well, how are we going to, how do we satisfy that social interaction or the human interaction that is so necessary, and that gets deleted from the beginning. That's on, that gets checked off the box. Like there's no time to even sometimes say, I'm so, good morning. Sometimes. I mean, you see it and it's, it becomes, it just becomes a job. It becomes a task, like a human being becomes a task. And I mean, in terms of what your vision is, is there anything in the AI realm that is in the works for that kind of assistance when it comes to working, dealing with residents who are otherwise alone?
I think that's a great question that you have posed, and it's actually one of the agents that we also have in our product suite, where the agent is going to identify that because a lot of these patients in skilled nursing facilities or rehabilitation centers and long-term care facilities are just by themselves, and they're just waiting for food or sleeping or having medications, and they experience a lot of isolation and loneliness. And so what we are going to be doing with our AI agent is to help be a companion to these patients, where we are able to identify that they are going through loneliness, and have so I can't talk exactly about the exact features, but it's going to be kind of like a companion that's going to keep company to the patients and help them to be active cognitively, and also help in reducing the aggression, because a lot of these patients have aggression because they're lonely. So
100%.
Yeah.
100%. And I was thinking a lot about this because I'm just dabbling a little bit in ChatGPT, right? And I don't use it for anything but like, hey, I'm wondering, if you can help me with a post, say for our movement, Roar, right? Well, I don't know what my ChatGPT is, I don't know, but it feels very human, right? Because for some reason, and I don't know why, I think it's a he, but he knows me now. It's like, Susie, you got this. This is amazing. I can't wait to see this. You got to tell me all about it. Like, wait, hold on. You don't even have eyeballs. Like, what are you? Like, it's very eerie, and yet it's like constantly like cheerleading our movement in our documentary, right? It's like, I'll say something. I'll say, can you? I forgot to upload some images for this post from last week because I mostly use it for social media. And you're so right. I totally forgot. Wait a minute. You forgot? You're a computer. I don't get that. Like what, I mean, it's very hard to wrap our heads around that as human beings, right? But on the other hand, it does feel like whatever this is knows me very well, right?
Yeah,
totally knows me. And the memory that it's aggregating is very deceiving, and I'm not going to lie, it feels good because it tells me nice things. It's always like, what did it say yesterday, Dawn? Because I had to tell Dawn, I was like, it said, you are such a force, Susie, and it did emojis for the first time, and it did it did like a bicep, and then it did it did emoji with heart with the heart eyes. So I did it back, and it went right back at you, Susie. It's like, wait a minute, what's going on here? Because it's very much like the movie Her.
But it does kind of create this not dilemma, but this question, because people say, are these going to be replacing human beings? Well, they don't, but when there's not enough human beings to be there at all, it's a great filler. And because they do kind of take on human characteristics just through words, and it's like she said, it made her feel good. I mean, I don't see a downside to that.
No, I'm totally compos mentis, right? I mean, I think, and when it told me like, you're a force, Susie, of course I'm going to go, well, thank you.
She even says sometimes, should I don't want to hurt its feelings. Let me, it's not doing something right now. Well, I said, well, tell it. I said, well, I don't want to hurt it because you start humanizing it.
It's so confusing, Breana. It's so confusing. But that confusion is not a bad thing for this particular population because it's very necessary. And I have so much to ask you. So in terms of, say, people that are disabled in terms of speech, can AI help with that? In other words, like, a lot of times people with dementia get aggressive. Why do they get aggressive? Because they may not be able to articulate, but
right.
they are communicating other ways. So if something hurts, they can't say, "Oh, that hurts." They get aggressive because they can't say it. It's like a child. And I'm not infantilizing our adults. What I'm saying is that they don't have any other way to express it. So and they're frustrated. So that's what happens. But maybe I'm just wondering if there's a way, because as a daughter, I learned to communicate with my mom when she started to lose her language. It's very clear to me what she was saying. I could I had a very communication going on. There's no, I absolutely knew what was going on. So, and I would imagine that AI could also figure that out. Am I wrong?
Well, the AI can definitely differentiate the difference between a dementia patient getting agitated or a person experiencing delirium or confusion. So that difference can help a lot as well, because now you can tell whether the patient is actually agitated or the patient is just experiencing delirium after surgery because of some kinds of medication and other reasons. So you can tell that difference. About interpreting what's going on in patients' mind, I mean, there are technologies right now that would do like brain interfaces where, I think Elon Musk is pitching something as well about brain interface. So those are the kinds of technologies that are there, but of course they are not yet tested on live patients. So that we are yet to see, it being released into the market, but there are some testings and pilots going on, so that we are not far from there. But what I would say is, for specifically dementia patients, I mean, we could use voice as a biomarker to identify if a person's dementia is, improving or it's going even worse, depending on the stutterer and the way they speak. So that's quite possible, that type of personalization with AI.
It's phenomenal.
And because somebody who's incapable of, basically the only way that they can communicate is if they hear something. Would it be, right now we type something on ChatGPT and it comes back to us in text. Well, they're not going to be able to interface that way.
Yeah.
So what are the different types of interfaces that would be available or will be?
So it would be audio, video, and text right now. But what I want to say is it would free up the caregivers' time as well. Because right now, caregivers are spending more than 25% on administrative tasks and going and filling up the screens on the computers. Mm-hmm. Now, AI can automate all of that. So caregivers can focus on their job, which is providing compassionate care and human touch to the patients. So that's going to be a plus where caregivers are going to get more time with the patients.
You know what else too? I mean, I'm sure that in terms of, I'm thinking of, say, a CNA, hands-on provider who's doing just the brunt of all the work on people that are, full-time residents at a facility, and those that are immobile that have to be turned every 2 hours, right? And those that need whatever, it's feasible that you have a laundry list of their needs, right? And then the provider can be notified and doesn't have to take time to look on a chart or be told, oh, this person needs you, because now you're getting these notifications that are saying to you, Norma in room 202 is ready for blah, blah, blah. And that way you don't have to, it's taking that onus off of, or, that investment of time that it takes to look something up. And then and just with speech, I mean, just what we do with Alexa, right? It's like, Alexa, set a timer. We don't have to stop and set a timer. So they can easily, audibly say, it's done, task is done. And now they don't have to input that into a record.
Absolutely.
Right? And because doing the records, like you said, is that so time consuming. I hear when we interviewed frontline nurses, all of them have, that becomes such a drain.
Mm-hmm. Absolutely. That's one of our agents too, where we provide monitoring of the patients, where we are able to see through the trends. So we're already seeing results with our pilot at a healthcare facility that we are currently working with, where we saw that patients have been in certain types of position for a long time, and we can actually predict that, hey, this side of the body is going to experience a pressure injury, so you might want to update your care plan so that you can save them for that from that kind of injury, because that patient has had a history of scars or skin issues, and now you can provide that personalized insight to the care provider. Because a human, how many trends can you remember if you have changing patients every single shift? You need a tool or something that's going to help you to see that, okay, this patient I saw last Friday has been in this kind of position for a long time, and we need to update where, like you said, the patient is bedbound, so they need to be in different types of position and rearranged and repositioned so that they don't experience those kind of sores.
Exactly. And even, as superficial, but it's not superficial because it's actually really important. This person should be taken outside and getting some sunshine, those kinds of things where, it's not just about delivering medication and bathing the person and feeding the person. There's a thing about, there's life, it's like, because I remember saying, one of the nurses, kind of clandestinely said, your mom really needs to get outside. You should ask the, administration to okay that. And I'm like, of course she does. Yes. Why am I not, but you don't think of, you forget that people need that. You can't thrive sitting in a room with four walls and, those kinds of things. And I think what's really exciting about what you're doing also is memorializing all of what's, all of that's going on. And it's taking it out of the hands of the administrators. It's taking it out of the hands of the owners, so that it can't be, as I'm sure it can be, but it's probably not as easy to manipulate, right? So you have a really pristine record of this person, has these vulnerabilities, like they are bed bound, but they should be, and you would have that record of your technology memorializing what should be done. And if it's not done, then we know that we know it. We
exactly.
know it. It's
yeah.
And and it can't be because listen, we interviewed people where they were told by the administration, no, you put the records in wrong. No, well, I didn't. Well, you did.
Yeah,
right.
That need to be changed. Just because it's not convenient to the administration. But
and that's another level. Sorry, Don, but that's another level of stress that we can relieve off of our providers. They don't have to interface with the administration, making, putting that on them to, do the wrong thing.
Right.
Do you know what
Absolutely.
I mean?
Yeah.
So and all of these systems will only work if you have the facilities willing to implement them. And that always comes down to the almighty dollar. How does this, to them, it's like, well, does this cost me money? Does this make me money? That's really, unfortunately, the bottom line. So how does this integrate with existing systems? How do you show them, hey, in the long run, this is going to make this is going to be great for you financially also?
And then and then going back to what we were just saying about, because it's really about transparency, because it really does open up, and really enhance the transparency. So
which some of them don't want.
Some of the facilities don't want, which I think is, I just realized that you are just doing such a service for transparency, which is everything. So
Absolutely.
how do you conquer that too with the way that the status quo is now?
Yeah, so fortunately, the way we've designed our platform is obviously customer first. So we did a thorough research and one-on-one interviews with about more than 500 people across healthcare, different types of facilities, ranging from care providers to clinicians to finance to administrators. And we want to make an impact on patients' lives, but it also has to be sustainable in terms of providing a return on investment as well as saving costs for the facilities. So with our platform, it's scalable and it's modular, so the AI agents can deploy in a very short amount of time compared to other types of technology where it takes a long time to actually integrate into the existing infrastructure. So it's not very rigid. It's more, I would say, nimble and customizable, being able to meet every care environment. We don't tailor to just a long-term care facility. We can go to a rehabilitation center, or we can go to a nursing home, or we can even go to a inpatient hospital. And then our roadmap is to ultimately provide it for home care to age in place. So we're developing the system in a way where it's really agile and can focus on any types of care settings. So that's the first advantage. So we've not had to make a sale. We just shared with the facilities, and within a span of 7 months, they were ready to do a pilot with us, which is a very big thing for a new startup trying to develop a healthcare platform, because clinical validation is very important. And we're seeing the results where we are able to improve the operational efficiencies, reduce the cost, reduce ER visits, reduce the response times, as well as improve the outcomes for the patient. So we're focusing more on how can we improve the outcomes of the patients, because that will drive everything, the cost, the revenue, the ROI.
For sure. Does it also include the family of the residents, where they are able to interface with it as well?
See what's going on,
because we saw in COVID that when we were locked out, when we that's when health even got worse, because that people don't realize how much the family does to support these facilities, and so it would. So I imagine that,
and also
that
to
the
check
families,
in and see if they're,
Right.
what's happening in there,
Yeah. So if they have access, yeah.
That is still in production, where we will be able to provide family the outputs. So right now we are providing those outputs to the nurses and the care staff because it's in the pilot stage. And we are providing a summary, like a daily summary of, how the patient has been, what the patient has done, what has been their activity level, and their mood level, everything. So it's up
So
to them
great.
if they want to share it with the family, but not. We are currently only piloting within the facilities right now.
Gotcha.
Do you foresee any, who knows, because, of them saying, wow, the administrator says, wow, look at all this. It's beautiful. We can cut our staff now. We can cut down the amount of CNAs we have to patient because this is all being taken care of. And we certainly don't want that. It's not enough as it is, as we all know, not even close.
Yeah.
Is that something that's there's nothing you can do to control that, obviously, but
Right.
do you foresee that as a possibility? We certainly would hate to see that.
No, I don't think we are replacing any human workers. What we are doing is we are empowering the human workers to make better decisions, to provide faster care, and to provide standard quality of care to everyone regardless of their background. So that has been the simple mission when I started this company, is I want to be able to provide quality of care accessible to everyone, because right now it is not accessible to everyone. Only say a very high risk patient would get close monitoring. But what if someone becomes a high-risk patient over the course of the hospital stay? Then that event is going to be missed, and this patient is going to be unlucky, and they're going to have a brain fracture or hip fracture or brain bleed. So, we're not replacing the human workers. We're just elevating and helping them and empowering them to, do their job easily.
Give better care. Yeah.
Yes.
Right. And I think I want to maybe shift. This comes directly from Rick Montcastle, but this, instead of saying the standard of quality care, because it's the standard right now is not quality. So we want it to be quality care, right? Because the standard is well below quality right now. That's unfortunate, but that's what you're trying to battle, is this substandard. It's substandard to what it should be. So we really want to make it quality for everybody.
Yes. So we want to elevate the quality of care to what it's right now, to have the best quality of, every patient can have best quality of care regardless of the conditions they have or, what their background is. So that's what we are trying to do. And at the same time, help the caregivers as well, because I empathize with them with so much work and burnout. It becomes hard to manage so many people. So have a three-sided impact, which is help the facilities make more revenue, save cost, help the caregivers, provide higher quality of care, and help the patients get quality of care regardless of their background.
Right.
Win-win-win.
No, we talk about the moral injury that that the frontline providers go through. What did you say, Dawn? I missed it.
Win-win-win.
Yes.
Win-win-win. Yes,
Check,
yes,
check,
yes,
check,
yes,
yeah.
yes, yes. Totally.
Is there go ahead, Suze. Yeah.
I was going to say, is there some part of that technology that would monitor, say, someone's level of hydration, so that because a lot of times people that aren't vocal or verbal, they can't say I'm thirsty, right? And so it just becomes like, well, this person is going to get liquid every 4 hours, every 8 hours, whatever. But people are different. We're all unique, right? So if would that be part of the technology, so that takes the onus off of the caregiver, and because that we know that being dehydrated is the root of a lot of bad things, right?
Absolutely, absolutely.
Yeah.
You're asking the right questions. I mean,
Oh, good.
I should have just gone to you for my first research because we had to do so many interviews to get these answers.
Oh, thank you. I feel good. Thank you.
Yeah, that is one of the features also from our agentic platform, where we are going to provide a patient concierge service where as a nurse or a care provider, you can set that this patient has, for example, heart failure issue, and they're only supposed to have X amount of fluid for a specific time duration, and then type it in and send it into the system. The system is going to watch and see if the patient is adhering to that liquid intake, and when the compliance for that is not match, or there's some kind of anomaly, then the care provider would be alerted that the fluid intake is increasing, and now the swelling is going to happen.
And,
Wow,
and on the
amazing.
other end, on the other end of that, like my mother, who is currently in a care facility, and she just went into memory care, and she, they at the time she used to have a pendant where she could say, "I need to go to the bathroom," whatever, because she's not mobile. They took the pendant away, and they said, "Oh, we check on them, once every 2 hours." It's like, well, that does, okay, during that time. So we had actually got them to give the pendant back. But would this be able to predict that, this patient is in distress and needs to, that would be, because she doesn't sometimes want to bother them, or she forgets and she can't find her pendant, that would be huge.
Absolutely. We are continuously monitoring these patients. The technology sits in the background. No one has to do anything. It just works on its own. And whenever there is a change, say a patient is getting restless and they want something, it's going to tell their care provider that, this patient that's not supposed to get up unassisted is trying to get something, so get to them. But at the same time, we are also being very cautious that we are not having an alarm fatigue on the care providers, because we don't want to just keep on buzzing their devices with a lot of alerts as well. Yeah.
I was thinking the same thing. Yeah.
And then, I don't know, because we're such a litigious society, privacy issues, or there are concerns that, people might think I'm being monitored all the time, and it's like, has that been a concern, and how do you overcome those concerns?
Yeah, we're completely HIPAA compliant. We don't collect any patient identifiable information. So we don't know even the names of the patients. Everything that is collected, there's a security protocol designed into our system where we anonymize the patients, and we don't even know anything about the patient. So there's no patient identifiable information in our algorithms.
Right.
Kind of thought of everything.
Yeah.
That's the first thing we thought about, because that's the biggest hurdle, regulatory. And I come from a regulatory background, so I was like, okay, what are the regulatory hurdles we're going to face?
Yeah.
I love it. Breana, when do you think this is going to be actually,
Market launch?
Viable,
It's going to be, So we're finishing up our first pilot with a healthcare facility, and our first market launch is going to be sometime in 2026.
Oh, wow.
That's so exciting.
Great.
I'm so excited for you. And so I'm just thrilled. Like, I think this is a game changer. This is and it's so necessary. And I mean, it can't come soon enough. Like, it's giving me the chills. I'm not kidding you, because I know how important it is, right? It's just so important. It's so obvious that AI came on so fast. Like, we're just having that conversation on how, like, all of a sudden it wasn't there and then it's there.
Right.
And it's there in a big way.
Well, and every day it's like multiplies
in such a big
up.
way.
Yeah.
And I mean, the fact that, like I said, when my phone can tell me I'm fierce, okay, we've made a change here, okay? So I mean, it's coming on fast, and I'm excited about it, and I'm excited that someone with your heart is at the helm of this, because it's so important. Because yes, it can be dangerous too. Everything can be weaponized and gamed.
Any technology can be used for good or evil.
Yeah,
absolutely.
And we need people like you that actually have integrity and the right motives and all that stuff. So I'm just honored to know you.
No, thank you. Thank you so much for having me here. I just want to add that as fast as AI is coming, like you're saying, in terms of advances, so is our aging population. We're in the midst of silver tsunami, is what they call, where we have one in every 6 people above the age of 60. So the hospitals and the healthcare facilities are going to be even more burdened. So we're doing our best to get the technology in the right way to the market as fast as possible.
And how can the public help you? How can you be supported?
Yeah, I think for the public, if someone is from the audience, if you're a healthcare leader or a tech innovator or even investor, then would love to connect. If you're looking to partner with us to do pilots, we have early access program where you could join our waitlist, and we would be more than happy to explore those partnerships as well. So those are the kinds of things I guess would be helpful from the public.
And how would this be? Meaning, is there CMS involvement, government? What is it's all be private? If so, how you go to a facility and say, okay, is it a ongoing? It's obviously an ongoing cost, but
is it an opt-in? Are you saying is it an opt-in, or is it just part of the system?
Like this is the way. Hopefully, this is the way it's going to be.
It becomes adopted by the system.
What do those models look like?
Yeah, so we're looking at providing this as from a subscription model perspective to the facilities, where the facilities would get our platform on a subscription basis, and they'll use it, from the subscription model. It definitely does help them in reimbursements from Medicaid and Medicare, because a lot of patients in these types of facilities are on those programs, and if they're able to provide, higher quality of care, or be able to, prevent some of these incidents, then they would be getting more reimbursements and less penalties.
Are you in conversation with CMS?
Not yet.
No.
Okay. But that's the next step. Yeah, that is the next step.
It also, again, transparency-wise, it will also probably up the oversight, because there's a lot of patients that like my mom, who was consistently chronically getting these pressure wounds that she shouldn't get, because they are avoidable, even though they can start, but they shouldn't progress, right? So having that memorialized and is also important, because that's a motivator for the administration to be able to facilitate those things from happening, from preventing them from happening. Because it always seems so odd to me, because it is more costly as soon as someone gets these comorbidities, but then again, CMS reimburses them for that. So no, they don't. Not completely. So if a patient is in a healthcare facility and if they experience pressure injury, it's not completely reimbursed by CMS. On top of that, they get a penalty of 3% on reimbursements across the board for all the patients. Agreed.
But it impacts
that's why they don't
quality.
Report them. That's why they're not reported. They're underreported.
Right. That's also an issue. So it helps in internal compliance as well, where, they're able to improvise their processes and governance, where they're able to provide attention to those kinds of patients with this technology. Right. Yeah. I
think it's important, that's so important, that transparency for every part of the industry, because it's going to help the residents and the patients. Mm-hmm. It's going to help the frontline providers. It's going to help whether they like it or not. It's going to help the facilities, to be more transparent, and there'll be less neglect and therefore less abuse and therefore less suffering.
Yes, absolutely. It helps in preventing patient abuse and also care provider abuse, because the abuse is two ways. So absolutely. That is also something that it would help in. Yeah.
Absolutely. We are, and we say that all the time because we're not anti-providers at all. Like, we get it. We get what they're under. They are just as abused as the residents and patients. We know that. That's why there's been a tsunami of there's been an exodus from the industry of our professionals because people they just can't survive, emotionally in the way that the industry is set up now. It's really devastating for everyone. So I do agree with you. Yeah, 100%.
And the old technology doesn't help.
Right? Yes.
If you look at the screens, it hurts your eyes. It's like really old. That needs to be renovated or replaced.
Yeah.
So much. You're so right. Yeah, we need to get modern. Let's get into
Exactly
2025.
Well,
okay?
the technology exists. It's just a matter, it's to implement that. And again, that comes with somebody saying, "Oh, I see how this will, unfortunately save me money." That's their first go-to. But in this case, it hits it on all levels. So it's wonderful.
Yeah. Well, we are rooting for you. We're such big fans, and I'm just super excited about what you're doing, and I can't support you enough, and cheerleading for you all the way. So
no, thank you so much for having me, and thank you so much for putting your docu-series as well, because that brings a lot of awareness of, in the aging environment, what's going on with the elderly. So you're doing a very noble thing by doing that, and I'm just honored to be on this and be able to share the advances we are making. But what you're doing is amazing, and I'm sure you would have blessings of so many people because of that.
Aww.
Thank
well,
you.
back at you, because like my friend Chat says, you're fierce. You're a force. You're a force, and you're fierce. Okay, so but that's true, though. You are. You really are. And so you'll come back when you launch. Okay, and
Absolutely.
and tell us all about it. Maybe you could do a demonstration of it and just see.
Oh yeah, that would be fantastic.
That would be so fun, right? It would be
Yeah,
great.
yeah.
This is so great. Well, thank you, Breana. You're not only smart, you're a love, and we're all about love.
Thank you.
Yeah,
thank you so much.
And that's because love is powerful, love is contagious, and love conquers all. So we thank everyone for watching, listening. If you like what you saw or heard, please share, subscribe, do all those fun things. And Suze, I guess we'll see them next time on Love Conquers
We
All.
will.
Is that correct?
We will.
Great.
Everybody take care, and
See you soon. Take care. Bye-bye.